Today's episode of Vital Voices is brought to you by Oak Tree Medical Center. Are you enjoying Vital Voices? Do you find our conversations educational, engaging, and inspiring? Then like, subscribe, and tap that notification bell to keep updated on new episodes and more. Music. It moves us, inspires us, and heals us. But did you know that music is also being used as a powerful tool in medicine? From reducing stress and anxiety to easing pain and even aiding in stroke recovery, music therapy is making waves in the healthcare world. Welcome to Vital Voices, where we explore the many ways health and wellness intersect with our daily lives. I'm your host, Alexis Burrows, and today we're diving into the fascinating world of music and medicine with Dr. Norad Morgan, a dedicated physician in the Infectious Disease and Immunology Department at Princess Margaret Hospital and co-owner of Emmanuel Medical Center, who has seen firsthand the healing power of music. In this episode, we'll explore the science behind why music affects our minds and bodies, how it's being used to treat everything from chronic pain to neurological disorders, and practical ways you can incorporate music into your own health and wellness routine. So, whether you're a music lover, a healthcare professional, or simply curious about new ways to improve your well-being, stay tuned, as this is a conversation you won't want to miss. So, welcome to the show, Dr. Morgan.
Thank you, Alexis.
This is a very interesting and exciting episode for me. You and I got connected a few months back working on another project. But that project obviously kind of birthed a conversation about, your interest in music and medicine and where the two intersect. And so from the first time we spoke, I knew I wanted to get you on the show so we could kind of explore this conversation and, tap in for our listeners to get an understanding of where music fits into the world of medicine. I remember when we first spoke, I told you about this clip from a show that I had seen where there was an older gentleman who was suffering from memory loss, Alzheimer's, and the physician wheeled him out of the hospital room and to his granddaughter's wedding. And they started playing a song that he was very familiar with. He started singing along to the song. And then when his granddaughter came up, he remembered her name and he wasn't able to remember anything like that. And I remember that when we started to talk about this because, in my mind, I'm looking at it and I'm like, is this real? Like, is this something that's happening in real life where people are using music in this way? So that plus our conversation has kind of led to us getting to this point today of being able to kind of talk through where medicine fits into music. Where music fits into medicine, how it works and all of that. So before we dive fully into that space, it's funny, I was talking with my wife before when we were preparing and doing research for this episode, and she mentioned that, she used to do ID clinic when she was in Princess Margaret Hospital, so she remembered working with you.
Yes.
And I was like, wait, hold on. And as I told you just now, I forgot that you were in infectious diseases because you have interest in so many different things.
Yeah.
But, before we, like I said, dive into that full topic, can you share a little bit about your background as a physician and how your interests developed in this intersection of music and medicine?
Yes. Well, I started music from the age of about 7, playing the piano. I did it throughout my teenage years. I played in church. Kind of stopped. I don't know, got caught up with, the academics of high school and preparing for college. But when I went to college, I took one course, and I think it was an introductory course in music, just as an elective. And then in my first semester, although I was a biochem major, a pre-med major with my eyes set on doing medicine, I decided that I will double major. And so I double majored in both music and biochemistry. And so I was torn between these two disciplines, right? One, the artistic side, and then the heavy scientific, with all the nerds and the scientific nerds and doing experiments. So I was torn between these two departments. And my major in music was specific. It was music theory and composition. And so I have a love for music theory. Although, I'm a pianist and I play and I believe in performance and stuff, my joy is on knowing how music is formed, like the structure of music. And so that's how it came to be. I went to medical school, played throughout medical school, did postgraduate studies in immunology, still do music to this day. I play at my church. I'm the music director of several choir groups in my church. I have a little jazz band, so I play around town. and I'm soon about to teach music.
Mm-hmm.
And so, my wife and I had a conversation, and sometimes we as men, we get to a stage in our life like, Lord, what's my purpose here? And then we started to talk. She said, well, what do you have? And this may sound weird, but in my mind, I thought of the 3 M's: music, medicine, and ministry. And in my mind's eye, I actually saw, the Venn diagram where the 3 circles intersect: MMM, music, medicine, and ministry. And so I started to think about, how do these intersect? How do these interrelate? And from that, ideas kept coming, and I started to do research on how music affects medicine, how medicine affects music, how the two intercalate, music and medicine. And for the past maybe year now, I've been doing my extensive research, reading scientific papers, reading anecdotes, seeing videos on TikTok and Instagram and YouTube on how music affects medicine. And so I'm now on this journey.
Awesome. It sounds like you're pretty excited to bring this into your practice. Have you had an opportunity yet to engage with any patients in using music as therapy?
Well, there is a plan. I have not formally integrated it into my practice, but I do share a private practice at Emmanuel Medical Center with Dr. Sean Knowles, who is a mental health specialist. And I think this, would be a great idea, so we could use this in our practice.
Okay.
Yeah.
So,
but it's coming. It's coming.
No, that sounds great. Yeah. So obviously, there's no gentle way to say this.
Yes.
If you're gonna double major when you're already doing biochem with anything else, that means you were squarely in the nerd group.
Yes. From
Jump Street.
From SAC days,
From the early.
A lot has changed since then.
But I imagine, like you said, the science behind the interconnection of the two is something I imagine that you've been very drawn to.
Yes.
So, one of the things that, like I said, in looking at some of the research, there are a number of studies that have started to show that music has measurable effects on the body, from things like lowering blood pressure to reducing stress hormones, things like that.
Yes.
So can you explain, from the nerd's eye view, some of the key physiological benefits of music?
Yes, so some of the key physiological benefits, I like to take them systematically.
Fair.
So first, the cardiovascular system. We know that no system works on its own in the body. So the cardiovascular system is connected to the brain, right? And so however the brain is affected, so heart rate, blood pressure, are all really mediated by higher centers in the brain. And so studies have shown the brain-heart connection, via nerves, via the autonomic nervous system, and that's how they work together. We know that music, if I were to jump straight into it, music, right? And it's usually preferential music, whatever the patient or the person likes. Music can lower heart rate, right? It can relieve stress by lowering heart rate, lowering blood pressure, lowering your respiratory rate, right? Music affects the brain. So it affects parts of the brain that deals with emotion, right? And pleasure, such as the mesolimbic system, the amygdala. And so music affects these in a positive way, right?
Okay.
Right? What music does, it gives you pleasure. It relaxes you. And somehow, scientifically, physiologically, this now translates to the cardiovascular system, and it is, interpreted, or it translates into lower blood pressure, lower heart rate, right? Lower respiratory rate. And so music at the brain level relaxes you. It gives you a pleasurable sensation. Now, you use the word measurable in a scientific way, in a physiological way.
Right.
But at the brain level, higher centers, it's an appreciation of it. You like the music you're hearing. Some people like classical music, some people like jazz, some people like soca, some people like rock. And so that pleasure, the pleasure centers of the brain are stimulated, and it translates into a relaxed mood, right? And so the interconnectivity between the brain and the cardiovascular system, the brain and the respiratory system, but also, I can't leave out the immune system. I'm an immunologist. And so I remember when I was doing postgraduate studies, the sun and the time of day, your immune system functions differently depending on the time of day. It responds to light. But the immune system, a lot of the studies, and this is just simplistically, I hope we have another episode where I could actually get into the science of it and, go through papers, probably episode 2. But
definitely.
The immune system responds to pleasurable music.
Right.
But on the other side of the coin, I just read a paper a couple of days ago, the immune system responds to noise. And noise is disorganized sound.
Yes.
It doesn't give you that pleasurable sensation. And so you could see that it affects the immune system in an adverse way.
Right.
But music affects if it's pleasurable music, if it's a music that the patient loves or the person loves, it actually acts as an immunomodulator, an immunostimulant. So the white blood cells increase, the T cells increase, the macrophages, the dendritic cells, but noise somehow intercalates with, we talk about that stress hormone called cortisol.
I was going to say, I wonder if that's what it is.
Yes, so the hypothalamic system, the HPA, which we call the hypothalamic pituitary axis, eventually works from higher centers and gets to the level of a neuroendocrine effect where hormones are produced. Cortisol is one of those stress hormones.
Right.
And we know the devastating effects of stress, right? So when cortisol is produced, and we know that cortisol and stress doesn't work well with the immune system, right? So cortisol can actually have an adverse effect on the immune system. We know that cortisol is, it causes immunodeficient states, and it causes the immune system to not function well, right? And we know that biochemically, right? But music now, in some studies have shown that music, and when a person is relaxed by pleasurable music, by music stimulating the higher centers of the brain, cortisol levels are decreased. And so you become stressless and stress-free. Cortisol levels are reduced. And this may translate into better functioning of your immune system to counteract diseases, cancers. Now, when we talk scientifically, no study is perfect. So this is still a work in progress. They're still trying to tweak to get better studies, larger sample size, stratifying your sample population, because it's a scientific thing. Yeah. And I am a conventional doctor, and we know how other scientists and healthcare providers are usually skeptical of non-conventional, non-pharmacological medicine, alternative medicine, or complementary medicine, we call it. But there is scientific data to show that music affects almost every physiological system.
Essentially, you're trying to get to the point where you'd be able to say it's evidence-based.
It's evidence-based. So evidence-based medicine is what doctors work with. Healthcare providers work with evidence-based medicine. Yeah. And there are some studies that are showing that music has great worth as a complementary. Some studies have even shown that music may be used as monotherapy, right?
As on its own.
As on its own.
Wow. Okay.
And so, especially when it comes to mental health conditions such as depression, anxiety, and some psychiatric illnesses such as schizophrenia, bipolar disease. So there are a myriad of studies out there. Now, as a scientist and as a physician, you have to read these papers very carefully. You have to see if the study is properly designed, proper sample population. Who's your population? Is the music selected for the clients? Because people could subjectively choose their own music that they like. So music and medicine, it's complex, but we cannot negate anecdotal evidence.
Right.
How music makes someone feel. How your favorite music makes you feel. Right. When you have a stressful day, some people like to unwind with their favorite kind of music with a glass of wine. Right? When they're exercising, they like that hype music.
Yes.
Why do we use music in Zumba classes? Because some studies have shown that fast tempo music increases exercise endurance.
Yeah.
It pumps you up.
Gives you the right frame of mind. I have a personal story I can't tell about music in the gym, but but I get your point.
Yes.
You know, it's interesting. Sorry, as you're going through that, one of the things that popped in my mind is like, you know, where does death metal fit into that? Because I'm like, you could like metal, you could like death metal, but I don't know if that's what I don't know. Like it.
No, but I'm sure it has its effect on
people who like it,
people's mood.
Right.
People like it. People like relaxing classical music.
Right.
Surgeons, and I'm going to get to some further studies, but let me say, it is not just for image and it's not just drama.
Right.
When a surgeon plays music, or the whole surgical team plays music in the operating theater,
I've heard stories.
It not only affects the surgeon, but it also affects the patient. And if you, you know, I can get to that later, but it calms you. Not that the surgeon is focusing on every note or all the words in the song, but it's anecdotal.
Right. If it gets them in a particular zone.
Yeah, because being a surgeon could be very stressful.
I'm sure it is.
You know?
Yeah.
And although you may have a run-of-the-mill surgery, things could go south easy, right? So it you know, it relaxes you and it puts the surgeon in the right frame of mind in a stressful environment.
Understood. You know, you mentioned a couple of things there. I think one of the things I'd want to kind of hone in on a little bit is, you know, music and mental health.
Yes.
Because you've indicated that that's one of the key areas where people are starting to see and recognize, like you said, even if it's anecdotally, this pattern of music being useful in that space. You know, what are we seeing with how that compares to, like, let's say, more traditional approaches, or an addendum to more traditional approaches?
Yes. Well, studies are showing that complementing traditional conventional medicine or pharmacological medicine, it works well. But we know that, and that is why the whole discipline of complementary and alternative medicine is with us and has come about. Because we know that pharmacological agents for depression, for anxiety, these have side effects. Pharmacological agents perioperatively, meaning before, during operation or preoperatively, before or even post-operative surgical operation, pain management, right? Anxiolytic, meaning something that makes you less anxious. A lot of these pharmacological agents, they have side effects.
Yeah.
Even for the critically ill in ICU, and a lot of studies have shown, a few studies have shown music in the ICU, in the critically ill patient, those who are mechanically ventilated. But we know that conventional pharmacological medicine has side effects. So alternative medicine and complementary medicine, which is becoming more acceptable by the conventional healthcare providers nowadays, has a role because all of these side effects sometimes create other problems. Now, I'm a conventional physician, right? But, you know, a lot of these agents have side effects. Music is what? Accessible. Music is cheap. No adverse effects. It's ubiquitous. It's all around us. You know, you could ask a family member, what is this patient's favorite kind of music?
Right.
What is their favorite artist? You could ask family members for an Alzheimer's patient or autistic child, what do they like? And you play that and you see how the patient connects,
right? How
the patient responds physiologically and emotionally and mentally. Music is powerful. And so you want something that would complement, and sometimes you want something that may be used as a standalone therapy. Okay. But from what I've studied, music is now being used in a complementary manner.
Right. That's the thing, you know. We've seen a lot in the last few years of leaning into, like you said, these alternative or complementary areas of medicine, as a way to bolster or enhance, or in some instances, even replace conventional therapy, conventional therapeutic approaches. So it's interesting to see that music is starting to kind of fit into that space as well. You know, going back to kind of the clip I told you about, you know, how realistic is that someone who is suffering from, Alzheimer's, or, even if it's like Parkinson's or stroke recovery, because these are some of the areas where you're seeing people start to talk about this.
So,
so let me ask it to you this way. Why would music, or how would music be effective in reconnecting like lost memories for a patient, or aiding movement, things like that?
Yes. So I've seen many clips of similar to what you've seen.
Mm-hmm.
Alzheimer's is a global, progressive, chronic condition of the brain
Mm-hmm.
that is characterized by cognitive decline.
Mm-hmm.
There are also behavioral and neuropsychiatric symptoms. In Alzheimer's, remember, Alzheimer's may make up is a form of dementia. There are other kinds of dementia, right? So it's music is now being used not only for Alzheimer's disease, but all the other dementia. But Alzheimer's makes up the bulk.
Fair enough.
In Alzheimer's disease, you may lose short-term memory, but that long-term memory tends to persist. If you have someone who lived in the jazz age, right? And their favorite song was Misty. They remember that. I've seen clips where musicians who play jazz, who have Alzheimer's disease, could go to the piano and without even thinking, play a jazz standard from the 40s and the 50s.
Oh, wow.
Long-term memory is there. You can go to a nursing home. I've seen clips of this. And you play, old-time music, depending on what music meant to them in a particular era.
Right.
And they connect immediately because the long-term memory, they're connecting with the long-term memory.
Right.
Right?
Right.
And so it's in there. It's in there somewhere. It's a very complex, and it's amazing how they would respond and connect to that.
Right. Because I think with that, you could correct me if I'm wrong, but if I remember correctly, with the dementia, like, group of conditions,
yes,
short-term memory is typically the thing that goes first, correct?
Yes.
Okay, so I guess as it progresses, you have that as a connection point back to
now. Both could go as cognitive decline really goes down,
as it escalates.
That's what makes the disease so awful,
right? Because like you said, it's progressive, right?
Progressive.
Yeah, it's interesting because I guess for me, as someone who I've been married now this year will make 12 years, right?
You're not having cognitive decline.
No. What I'm saying, what I meant to say is, there are songs that we played at our wedding, at different points of the wedding, that if I hear it now, I can, in my mind's eye, visualize where we were, like in the order of the service, who was standing nearby, that sort of thing. And so I can see how, that connection point kind of makes sense, because especially if it's something like you said, if it's a particular artist, if it's a particular genre of music,
setting,
or it's a particular setting, or if it's a particular song that is connected with a particular memory
or emotion,
right? Or emotion, right? So obviously you think about weddings, you think about like even like sometimes family functions, things like that. There's certain things. It's like I imagine, you put on the electric slide in an old folks home, and you might get people who have dementia or related issues, and they might still be able to get up to the electric slide. That's just
on the beat.
It's like my wife always is like a core memory, right? So it's something that the music can help them tap into.
Yes.
You also mentioned though, like children with special needs, so whether that's autism or ADHD, other developmental disorders.
Yes.
What is the music therapy look like in that space as well?
Well, I have seen so many unique forms of music therapy, and when we get to music therapy, we're seeing it's a specialized area where music is used to maintain health, to promote health, to foster health, and so these are trained specialists. I just want to say that who have a system that actually, it's an interpersonal system where the therapist relates to the patient, right? Using music. And there's a bit of psychology involved too. And might I just stick a pin here and say music therapy is being used in many big centers around the world. In pediatric centers with patients with brain injury, with autism, with neurocognitive diseases. It's being used in oncology centers for for pain control, for depression and anxiety. It's being used in dialysis units. It's being used in a lot of centers, music therapy. But in terms of autism, studies have shown that music therapy actually causes the autistic child, whatever part of the spectrum they're on, to actually relate. It fosters socialization. It fosters connection. So music is almost this vehicle that causes the child to socialize and to relate and to respond, right? Same thing in hospices and nursing home and geriatric hospitals. Music therapists are used there a great deal, right? So these two ends of the spectrum, children and the elderly and everyone in between, right? So, and in Alzheimer's patients, it works too, to allow that Alzheimer's or that dementia patients to connect, right? And so music therapy in these settings, studies have shown, really making waves.
It's interesting, because I think about it too from the standpoint of, you mentioned like all across the spectrum, given that it can be calming and relaxing, it has that impact on lowering like the cortisol, things like that. How does it fit into like palliative care, right? So when you're looking at people who may be, at the end stage of life because of some terminal illness or something along those lines, where does music fit as a tool in palliative or even like hospice care?
Yeah, hospice care. So, mood stabilizer, decreasing anxiety, decreasing depression, decreasing fear, calming the patient. There are also studies on music that calm you to the point where it actually reduces pain levels, right? And so this now reduces the load of like pharmacological agents in the patient. But it's usually used as an adjunct,
right?
Complementary, right? In palliation.
Yeah. Like I said, I think the conversation for me, even in just thinking about it, it's very interesting because there is so much that's happened in the space of medicine in the past few years, especially during and post-pandemic, that I think people are trying to find ways to, get help, but not necessarily in as a stronger reliance on solely the pharmacological space. So it's kind of interesting to hear how this is playing. So let's look at practical application, right? And what the future of music in medicine looks like. What would you recommend for someone who says that they're looking to incorporate music into like a daily wellness routine, right? Because that's something obviously, wellness and lifestyle medicine, things like that have been very strong buzzwords in recent times. And it's gaining quite the traction in the medical community. But what practical tips would you recommend for someone who's saying, well, is music something that I can incorporate into a regular wellness routine, and what that might look like?
Yes, what that might look like is simple. You choose the music that you like. If you're working at home, if you're doing house work, if you're in your office and you're able to, play your music quietly, or you may be in a space where you could play it loudly, you could incorporate that in your daily routine. And we mentioned gym, and we mentioned daily walks or daily runs. You have your music going. Now you have to be careful, because if you're not hearing, if you're in a dangerous area, you can be knocked by a car. But once you're alert of your surroundings, music has the ability to encourage you, right? As I say, to promote endurance and to fire you up to do your exercise. So you could incorporate into that nighttime music. And what I neglected to say, and I should have said, spiritually, music is very important spiritually. All the world's religions are definitely Christianity, but Hinduism, Islam, right? Shintoism, Buddhism, all of these religions have as a part of their music in their worship ceremonies. In Christianity, biblically, remember when the evil spirit was tormenting Saul?
David played the harp.
Young David played the harp, and the evil spirit dissipated. It came back, and David had to come back to play. and it went off again. So we see the spiritual power of music in deliverance, in healing. We haven't even gotten to music and healing.
Right.
Right? Music is all through the Bible as a spiritual vehicle. Right? In worship. What would a worship ceremony, I don't care what denomination you are in Christianity, what would a worship ceremony be without music? Music is that vehicle that takes our praise up to God.
Right.
Right? So spiritually, music is therapeutic.
Powerful,
it's therapy within itself. Right? Actually, I ain't gonna preach, but the Greek term for worship in the New Testament is therapeuo. So worship is therapy. And if you do further study, you know that terms like cure and healing and then worship. So when I studied that, I was like, worship, healing, and cure in the same translation. So worship brings healing. I remember Miles Monroe, and always talked about worship as spiritual therapy, spiritual massage. And he always mentioned that is why when you're in a good worship ceremony and the presence of God is there, you don't want to go. Because why? It's therapy. It's healing. Burdens are lifted through the vehicle of music. Therein lies another example of how powerful music is in therapy, spiritual therapy.
Listen, I'm here looking because I know because even the word itself, like
therapeuo.
Music isn't that the root word that to muse, like, so it goes back to the idea of thinking on, dwelling on, right?
Yes.
And so perhaps that's why I'm not a doctor, but perhaps that may be why the concept of music as it pertains to the mental health areas is there's so much benefit there because of just what it represents, like you said, right? Like when you look at whether it's from a Christian perspective or even
a physiological perspective, impacting the brain systems. Yeah.
I think there's a lot that can be kind of unpacked from that.
Yes.
You mentioned the concept of listening to what you like, and it being preferential. When you mentioned like cleaning, I know there's plenty of Bahamian mom and wife out there that has on, whether it's their worship music or, for some people it might be soca, it might be, whatever it is. Obviously the preference plays a big part in that, in how it affects you. Because if you're playing something that you don't like, then obviously you might have that negative impact. But I guess can you reinforce the importance of the preference as it pertains to that like emotional connection of music?
Yes. So people gravitate toward the kind of music they like because it's a positive reinforcement. It does something for them. So you're going to listen to music you like because it's making you feel good. Your mood changes. Right? You feel relaxed. You feel stress-free. Right? As we said, music in the brain, pleasant sensation is associated with memories. Memories is associated with pleasure, and so that may be why they're playing that particular music. Someone may like the dissonant sound and the atonal sound of jazz.
Right.
A lot of intellectuals love that caustic, dissonant music that I love, or that 20th century music that really has no point of reference. It's all over the place. You can't know where it starts. You ain't know where it stops. You ain't know where it going. Right? Atonal music. And that was my favorite music, my favorite era of music, 20th century music, when I studied music theory, atonal music, because it's all over the place, and it just evoked this kind of wandering, drifting, and it helped me think and imagine and stuff. It's another thing music does. So people gravitate toward they like, a lot of surgeons like to play jazz. A lot of surgeons like to play classical music. Classical music tend universally to give you that calming, very relaxed, intellectual feel, right? Jazz, you may be some people study when they play because music has also shown to increase cognitive ability. Right? Even
I'm thinking about the surgeons. I'm like, what does it mean if a surgeon likes to listen to DMX when they're in
I know how that would work.
Again, I've heard stories. But I think it is interesting. You mentioned, I think, two things there that are really important that I don't want our listeners to miss, which is the influence of music on the creative side of the brain.
So music and creativity.
Right. And also on the cognitive side in terms of, I imagine, like memory building, retention, that sort of thing as well. Going back to, like we were saying, if you had songs that played at your wedding or, you always used to listen to in your childhood home, those songs tend to have a connection, that you can't really get away from.
But we think of how music being created by the performer affects the listener and the audience. There's also a field of music psychology. How does music affect the musician? That's a whole different field. How does music affect the musician? When the musician is playing, when the musician is studying music, when the musician is practicing, what is it doing for the musician himself? I saw a clip on YouTube, or was it TikTok, where this world famous pianist, I can't remember her name now, I have it saved in my phone. She had to fill in for another pianist, big orchestra, world renowned symphony orchestra. And she showed up and she thought she was playing, how could I say this? She didn't, how could I say this? The piece that the orchestra was playing, she thought it was something else. She played that piano piece for the symphony maybe 10, 20 years prior. She didn't prepare it at all because she came with something else in mind. And I saw the video. The symphony's going. Time is going up for her piano piece. And the conductor knew what was going on. And that's another thing with performers. Sometimes what we're doing, we're messing up, but you would never know. Because we act like, and he is conducting. I know his heart was beating. And she is literally sitting on the piano like this. And her time came up. And she put her hands on the piano. And she played it perfectly.
Like
and she did it about
memory.
10 to 20 years prior.
Wow.
So memory and music and emotion and mood. And she played it perfectly and didn't prepare for that.
It's the things like that, because I know I've also heard people who play for people who may suffer from anxiety. And they have a musical instrument that they play, that in the playing of that instrument, it helps to reduce their feelings of anxiety and things like that as well. So that is true. A lot of our conversation has stemmed on the side of how it affects the listener, the audience, but not necessarily the composer or the performer or the musician themselves. Because I think that's the other thing too. Like, I imagine even for a composer, I imagine it feels similar to someone who writes scripts. It's like when you hear your music, whether it's in an orchestra setting, whether it's on the radio, whether it's at a concert, it might feel the same kind of accomplishment that somebody who's, written a movie and they get to see it on the big screen. It's kind of the same idea. That sense of, look at what I've accomplished.
Reinforcement.
It's an amazing thing. And I think, like you said, there's probably going to be a second part to this conversation that goes a little bit deeper into the science of it. But I think any conversation that we've had about medicine in the past few years, one of the key things that always comes up is where technology fits in the space, right? So obviously we know now that there are things like AI generated music. You have apps that are now dedicated to sound therapy. You have virtual reality experiences. Like, I know, for example, like the Calm app has they'll have the rainfall with some light music, and so how do you see technology continuing to shape the future of music in medicine?
Well, it is going to be, the good thing about it is, and the good thing about music therapy is the accessibility. So technology is going to be able to create music, so people are going to be able to find exactly what floats their boat. So technology is going to be able to facilitate that. And I just think that there are going to be endless possibilities of different kinds of music that does different things for people.
Right.
Remember, when we go into the science of music, it could become very scientific.
Right.
Different frequencies, right? Rhythm, tempo, different sounds, different instruments. You know, scientific studies are now showing that how high the pitch is affects your brain in so many ways, stimulates different parts of the brain. So it could become very technical.
Right.
It could become very complicated scientifically.
Right.
But I'm sure the music lover isn't gonna, you know, that'll probably be a bore for them. But for music scientists,
right.
You know,
but people are interested in the science part of it. But I mean, it makes sense, right? Because if you think about it, like even the way, generally speaking, like the brain of a mother is wired to where, you know, they recognize the difference in how their baby cries.
Yeah.
And it's like one cry means this thing, a lower pitch may mean something else, a higher pitch may mean something else. And they're attuned to that. So it kind of makes sense that if you take that and you pull music into the space of, you know, the baby crying, and it's like, okay, so a higher pitch may result in a different type of reaction than a lower pitch. Same thing with a faster speed, which is like, going back to your earlier point, when you talk about Zumba classes, that's usually salsa music, soca music, like spin classes and things like that. Yeah. Whereas, you know, if you were doing, I can't imagine someone going into the gym and doing a Zumba class.
Symphony.
Right. Yeah. That doesn't quite, because again, you want something that matches the energy of what it is you're trying to accomplish.
And so therapy, music therapy, should have a personalized component.
Right. Yeah. Right. Because it can't, because it's not a one size fits all. Yeah. And what you may like and appreciate, even as someone who is, you know, looking to integrate music into your medical practice, you're not necessarily going to say, well, you know, what I like, every patient should come in and use as like that. It speaks to the need for that personalized approach.
And this also affects future studies in how music affects medicine.
Right.
You have to stratify it. You know, all the variables have to line up. And, you know, because choosing the wrong music could be a limitation in the study.
Right. Right. Because all of these things you have to consider.
Yeah.
Like I remember when my wife was doing research and she was trying to explain to me, because you know, I was a business major.
Yeah.
I didn't necessarily lean into, you know, a lot of this stuff, but she was explaining like the importance of how any sort of data is collected, whether it's a survey, whether it's research for something like this, but the idea of like the strength, the confidence, all these different things that come into play that make
how robust the study
is. And it kind of determines how useful and applicable that information then is, as saying, okay, so we can now apply this in real world settings and saying that it's evidence based. So that it's that's why this stuff is important. That's why even starting to integrate it, to get more data, to get more information, to be able to prove the effectiveness of it is important. Yeah. Obviously, with something like this, like you mentioned, it sits in the space that is complementary / alternative. You know, what are some of the barriers or challenges that may exist in trying to, you know, incorporate music therapy more widely into a more traditional medical practice?
Well, you know, as I would have mentioned, healthcare providers, physicians may be skeptical
bunch
of the actual efficacy of music therapy. There may be, you know, so obviously we need evidence-based. Now, not all studies they show the same thing. There needs to be more studies done on music therapy. And funding is one of the problems. Getting the right studies, getting the right sample size, getting the right participants, right? But from what I know, a lot of the robust studies that are making it into trying to get into the mainstream medicine have dealt with music as it affects mental health disorders, stress, depression, and anxiety. Right. But in terms of pain management, cardiovascular management, that is now on its way. And sometimes the studies may contradict, but more studies need to be done.
Right, because then you can, it goes back to the earlier point, being able to measure it and say definitively, okay, we have enough, we've seen it work in this way in enough
Yes.
people to say that this is something that we can integrate,
So,
more definitively. So, as we wrap up, I always like to ask guests, if there's one takeaway you want to leave our listeners with, about the role of music in medicine, what would it be?
music has a place in medicine, and music is very important, and music is a part of our daily life, but it has a role as a complementary agent. I'm not going to be as bold and say as monotherapy, as standalone therapy, but it has complementary, right? A complementary role in management of many medical conditions.
Okay. Are there, because obviously you're someone who is deep in the weeds of research and information gathering on this. What are some resources or some studies you may want to point people to if they want to kind of see some of this information for themselves?
Yes, I've read many articles. I somehow we could communicate, and I can point you.
So what we can do is you can send me some of the links, and
I can send you the links
into the description.
Yeah.
Fair enough.
Music, and you could do your own search. Music and medicine, music and the cardiovascular system, music and the immune system, music and cognitive behavior, music and dementia, music and autism. Books have been written on music and autism.
Fair enough. Okay. Awesome. This has been an excellent conversation. I think, there's a lot of breadcrumbs here for people to kind of start to get an understanding of what this looks like, especially, kind of giving some direction for where they can go and look for the research themselves and get a bit more information. And like you said, perhaps we circle back around to this to have maybe a deeper scientific exploration of the role of music in medicine. But I want to thank you so much for taking time out of your busy schedule and coming on the show to talk with us.
Yes.
All right. So where can people learn more about you? Where can they catch up with you if they're interested in coming to see you as a physician? How do they get in contact with you?
So I work out of my private office, Emmanuel Medical, which I co-manage and co-own with Dr. Sean Lewis, who is a mental health specialist, right? And so I can be found at Emmanuel. Just call the office, book an appointment, or my cell number is always flying around now. So you could, I encourage people to WhatsApp me. That's how a lot of patients communicate with me.
Fair enough.
Through WhatsApp.
Okay. Awesome. All right. So thank you again, Dr. Morgan.
Thank you, Alexis.
All right. So that brings us to the end of today's episode of Vital Voices. Dr. Morgan, thank you for sharing your insights on how music is not just an art form, but a powerful tool in medicine. From mental health support to pain management and even neurological recovery, it's clear that music has a profound role to play in healing. If you enjoyed today's conversation and want to learn more, be sure to check out the resources mentioned in the show description. And if you are looking to incorporate music into your own wellness routine, start by exploring the sounds that make you feel relaxed, energized, or inspired. And as Dr. Morgan said, make sure it's something that you like. As always, we ask that you, subscribe to Vital Voices on your favorite podcast platform and follow us on social media for updates on upcoming episodes. If you found this episode helpful, share it with a friend or leave us a review. I'm Alexis Burrows, and this has been Vital Voices. Until next time, stay well, stay inspired, and let the music play. Are you enjoying Vital Voices? Do you find our conversations educational, engaging, and inspiring? Then like, subscribe, and tap that notification bell to keep updated on new episodes and more. We'd like to give a special thank you to today's sponsor, Oak Tree Medical Center.
Hope Empowerment Community. The second annual Fertility Empowerment International Conference is coming to Nassau, Bahamas on April 3rd and 4th, 2025. Hi, I'm Dr. Latazia Stewart, and this year's conference will feature engaging presentations, panel conversations, and expert-led sessions on navigating fertility treatments, workplace support for employees facing fertility challenges, the intersection of faith and family and fertility, research and new innovations in reproductive health and wellness. During our inaugural event at Atlantis Resort, the impact made by our speakers and shared powerful patient stories were transformational. And this year, we're building on that success. We're also excited to partner with our new host, Doctors Hospital, for the 2025 conference. So who is this for? Fertility warriors, healthcare providers, business and civic leaders in our communities, individuals exploring fertility preservation options. This is more than a conference. It's a movement. And together, we're breaking silos, shattering silence, and empowering individuals to build their families. So, join us for the second annual Fertility Empowerment International Conference. Together, we'll continue building families, breaking barriers, and creating a future filled with hope.